Joining me now is Dr. Gregory Nestor. Dr. Nestor's been on our program multiple times in the past for liposuction or vasal procedures. Today we're going to talk about fat transfers. And it's not just for aesthetics, it has a lot of different issues. So first let's go into what a fat transfer is.
Okay. Fat transfer is where we harvest the fat cells from one part of the body, usually the abdomen, the back, the thighs, the flanks, usually someplace the patient doesn't want it, and we'll place it where we need to replace volume. Someone may have had an injury, trauma, surgeries, say a lumpectomy, birth defects, aging skin, someone who has insulin injections and they get lipodystrophy, which is the loss of fat at the injection site. We can correct any type of skin defect with this.
So we're talking about taking unwanted fat and making it usable, or at least making it so it's prettier. Is this a simple process or is this something that's pretty complex?
It's a simple process. You process fat, you remove the fat, you use vasor, liposuction. And the way we do that is we numb up the skin with a very tiny little needle and we fill in the fat layer between the skin and the muscle with tumescent anesthesia. And once everything's numbed up, then we come in with vasor, and it's an ultrasound, and it'll shake all the fat free without damaging anything else. And we're left with this melted butter consistency, this liquid state of fat. This fat material has live fat sites, adipocytes, also has stem cells in it, which are alive and they're going to grow in the patient's own body.
So these are adult stem cells. We're not talking about the transfer fetal portions of it.
No.
And they have a lot of good benefits to it. Stem cells by themselves can regenerate. So how does this make a difference on this fat intake?
There are a lot of theories, nothing's been proven, but this fat does grow. It takes place, it gets its own blood supply, and the fat cells do grow.
And over time, it's not like it just happens overnight, right? So this is a process that takes a little bit of time for it to actually start to show back up.
Absolutely. The cells will be dormant for a short period of time, and then they start to grow, and the result actually gets better as time goes by.
All right. Is there a better candidate than others, or is there someone who should not have this done?
Nope. It's a very safe procedure. There's really no contraindication because we're putting back a person's fat. This is their own fat cells. We don't have to worry about allergic reactions, rejections. There's less chance for infection. And as long as someone's fairly healthy, it's a very safe procedure.
All right, now any controversy? Is there anything that makes this something that I shouldn't do?
Not really. There is a question about breast cancer detection. You can still detect breast cancer. There's no problem with screening. You want to let your radiologist know that you've had a fat transfer, you'll have more microcalcifications, and they can look for that. There's no evidence so far to show that there's any increased risk of breast cancer. So it's a very safe procedure.
So briefly outline kind of what you go through for this process. This is not just I go in, take some fat, and go somewhere else. This is an additional procedure on top of the vasal that you were talking about before.
Right. Once we've taken the fat out, gone through the typical vasor selection process, then what we do is the fat is set and we remove the liquid portion, the anesthetic, which is the normal saline, and withdraw that, and we're left with this canister of live fat cells. And sometimes we'll centrifuge the fat to make it more dense. Sometimes we don't do that. There's two schools of thought on that. Whether you should centrifuge or not, there's no real benefit one way or the other.
Okay.
When you inject the fat, you do it in very small aliquots because the fat, if you just dumped it in there, a large amount of fat, it's not going to survive. The fat has to develop its own blood supply. So we do very small aliquots, and it takes time, and you do it in different layers of tissue.
And you call this kind of an artistry, so it takes you a little bit more time when you're looking at it. You want to look at the patient, make sure it fits from one side versus the other to make it kind of look natural.
Exactly. We'll put a small amount in one side, go to the other side, put a small amount in, and just slowly do it until we get the symmetric appearance that we want.
All right. And now originally what happens is it's bigger and then it shrinks down, then it actually becomes bigger again as it grows, correct? How long does that take?
We put in more fat cells to begin with because we're going to lose a certain percentage. Usually about 60–70% of fat cells will survive. And then, so things become a little bit smaller, and then after a month or two of dormancy, the cells start to grow again. And you'll have one effect at 6 months, and then at 1 year it's even more pronounced. So it has a nice the fat cells are fully engraft at that point.
Well, real quickly, can you give us kind of a list of places where you can put this that would be helpful to the patient and a rough amount of cost? I know this isn't free, but obviously sometimes covered by insurance.
Sure. Any type of trauma, if someone's had a previous procedure, let's say they've had a lumpectomy or previous surgery where they've got a defect, they need to put volume in, we can use that. Trauma, if aging skin, we can put it in the face, the buttocks, lift the buttocks, we can put it in the breasts, as I mentioned, either for an augmentation, which is usually for half the 1 cup size, it's not a tremendous amount, and fill up any defects. Really any place, the hands, any place on your extremities, you can use it. Birth defects, it's got a wide range of uses.
Very good. All right. Well, thank you very much for joining us today. Sounds like an interesting procedure. You're one of the few docs in the Tampa Bay area that's doing this. So if anybody has any questions, certainly they can give you a call.
Thank you.
You're welcome.